For today, we will start with a little bit of introduction of the panelists, the presentation from the researcher from the climate centers and from the London Schools of Tropical Medicines. Rachel, correct me if I'm wrong. And after that, we have quite a lot of time. I think we would expect to reserve at least 30 minutes for Q&A. So the webinar will last around 1 hour, 30 minutes, giving time for discussion of these new and interesting topics. Thank you to everyone. And now I would start with a short introduction. So my name is Bing, and I am the Disaster Risk Reduction and Climate Change Adaptation Technical Advisor at the French Red Cross. I'm supporting our projects in various regions, including the Caribbean, the Indian Oceans, and the Middle East. Over to you, Janu. Janu, I cannot hear you.
Oh, let's get started.
Yeah.
So Juan and I are going to present to you this pioneering work that we have done with many colleagues in the Caribbean region. We have a lot of gratitude to our colleagues with CIMH, the Caribbean Institute for Meteorology and Hydrology, with CARFA, the Caribbean Public Health Agency, and many others who have contributed, but in particular, our colleagues in Barbados, in the Meteorological Service and in the Ministry for Health and Wellness, who have enabled us to pilot this methodology. Juan, over to you.
Hi, everyone. I am Juan Basso. I am working in the Red Cross Red Crescent Climate Center, and together with Janot and Rachel, we are driving this research in the Caribbean for impact-based forecasting and methodology for predicting arboviral disease. We will continue with the presentation. Bing,
No, over to you. I think there's still Rachel and Valentina to introduce themselves.
Okay, thank you. So, yeah, Valentina, go ahead.
Hi, everyone. Thank you, Juan. So this is Valentina Evangelisti. I'm the Disaster Risk Reduction Advisor at the French Red Cross. I specifically support global programs like the Three Ocean Program, in the framework of which this study was done, as well as the Riposte Program, which is joining approaches between epidemics preparedness and risk reduction and disaster risk reduction. And Rachel, I let you the floor to introduce yourself.
Thank you. Hi there, I'm Rachel Lowe. I recently moved to the Barcelona Supercomputing Centre with a new CREA professorship to start a new global health resilience team in the Earth Sciences Department. And I am still associated part-time with the London School of Hygiene and Tropical Medicine. Thanks.
Thanks a lot, Rachel. And we should not forget Cecilia, who has been on the back organizing every details of these webinars and sending on the invitation. Over to you, Cecilia.
I'm a disaster risk reduction assistant at the French Red Cross.
Thanks a lot, Cecilia. Well, over to you, Valentina.
Thank you. So I will take a few minutes to just quickly introduce the program that framed the study. It's a global program. It's called the Three Oceans Program. It's funded by the AFD, the French agency, French Development Agency, l'Agence Française du Développement. The program contributes to, so the objective of the program is to contribute to reduce the impact of disasters, epidemics, and the effects of climate change on the populations of three ocean basins. You can see on your right the area where we work, the Caribbean, the Pacific Ocean, and the Indian Ocean. The particularity of this program is that is taking place in small state islands. It has been developed across different phases, started in 2019 to 2021, then it also had a transitional phase, and now we are currently in the second phase, which will last until 2025. It's overall across all these phases around 10 million euros budget, and it involves 15 national and regional organizations, including one of our delegations, 2 regional response platforms, so the French Red Cross response platform in the Caribbean, the PIRAC, and other regional response platform in the Indian Ocean, the PIROA. 19 national societies of Red Cross and Red Crescent movement, and there's a typo there which I didn't spot before, sorry about that, and 67,000 people benefiting from the different activities. Next, please. So I will just go through very quickly the 4 work stream, the 4 outcomes of the program. It has the first one is mainly focusing on disaster risk management at institutional level and how it is integrated into the strategies and operations of key actors in the different regions. So again, Southwest Indian Ocean, Caribbean, and South Pacific countries. The second result focus on preparedness of our regional response platforms, of national societies, of the Red Cross and Red Crescent movement, but also operational partners, including local partners and other stakeholders that can be better prepared to respond to natural and health hazards and disasters. The third outcome is focusing on community-based work. That includes community-based disaster risk management, school-based work on risk management. It also included a component on small business preparedness to be more resilient to disasters. And all these approaches were adapted to small islands context specifically. The first result is the one in the framework of which we have realized this study. It focused on innovative approaches and development of tools, capitalization and consolidation of approaches and studies. It's meant to share the capacities, build and share the capacities of our platforms and of disaster risk management stakeholders. Next, please. So in the framework of the Three Ocean program, which is called Ready Together in the Caribbean, the activity of this study focused on different objectives. The study had the objective to develop an impact-based forecasting methodology to predict the risk of arboviral diseases in a pilot country, which is Barbados. To consolidate the knowledge on existing FBF, so focus-based financing work, and produce recommendations to implement it in the Caribbean, and to produce innovative research on hazards that have been increasing in impact. We already have in the Red Cross, Red Crescent movement experience in implementing focus-based financing for natural hazards, but we are now exploring how to do that in health and in this case for arboviral diseases, but not only. And last but not least, to promote the dialogue between the IFBF and IFBF stakeholders in the region. So as Janot mentioned in the beginning, we had the support of the Ministry of Health of Barbados, the Meteorological Service of Barbados, who provided all the data, and also the Caribbean Institute of Meteorology and Hydrology. And I will stop here, and I will let Juan take over and give you a bit more detail about the study. Thank you.
Janet.
Thank you so much, Juan. So Juan and I and the rest of our Climate Center team are really interested in arboviruses. Why are we interested in arboviruses? Well, in the Caribbean, there in recent years has been a very high caseload of diseases that are linked to this mosquito-borne vector. That is complicated because there are no vaccines. This means that we need to be looking at continual preventive activities. But we know that mosquitoes breed in water, and we know that weather forecasts can help us anticipate those breeding patterns and the outbreaks that are a result of mosquito breeding. So our big question is, how can we forecast the impact of mosquitoes breeding? Over to you, Juan.
Yes, thank you, Janot. Yeah, this approach of the impact-based forecasting system is not new. WMO, the World Meteorological Organization, is promoting more and more this kind of forecast to move away from forecasting that weather will be and instead begins the forecast what the weather will do. So in this case, rather than the meteorological agencies forecasting just only rainfall, they are starting to combine the rainfall forecast with information about the where the people live, what kind of livelihoods they are working in, and understand where we might see potential hotspots for disease outbreaks. So the idea is to quantify in this kind of forecast how many people could be exposed for this disease and understand what impacts to expect such increasing use of healthcare system. Janon, maybe you will introduce what is the impact-based forecasting system in the health.
Yes, this is a very exciting bit of pioneering work because this combination that Juan mentioned of the forecasting information has to do with rainfall, temperature, other climate factors, with epidemiological surveillance information, which is how people are exposed to disease, and also the presence of the disease, the background presence of disease in populations, can allow us to anticipate, to forewarn future impacts. So developing an early warning system for mosquito-borne disease allows, it's a form of preventive medicine because it allows us to program preventive care. That involves public health actions, planning, and it's really aimed at facilitating healthcare service provision in those populations that are vulnerable to a particular health risk. So this methodology that we're pioneering with mosquito-borne diseases in the Caribbean can be envisioned to be expanded for other health risks. An easy one, for example, would be to look at heat stress, which has a very strong climate signal. Over to you, Juan.
Yeah, impact-based forecasting is into an impact forecast is not enough. This kind of forecast needs to spur preventive actions to reduce the mosquito breeding habitat. For instance, this can be the break the lead between rainfall and mosquito breeding and avoid the potential outbreaks.
So what do we need for an outbreak to occur? There are three elements. The first is the disease needs to be present. In other words, it is in the mosquitoes. It's carried by the vector. So of course, the presence of the vector is also important. Not all mosquito species carry all the mosquito-borne diseases. So we need to understand a bit more about the mosquito vector. And of course, we need the exposure to a vulnerable population. Juan?
Yes, another key factor is the meteorological variables. In this case, we know, and many research, many focus in what is the most important variables to affect the mosquito peaks. In this case, you show the two different peaks, what critical term for maximum and minimum temperature, and what is the temperature to the peak of the transition to the mosquito. So this is why the mosquito are outbreaks, because they are very strong or very strong relationship with the meteorological variables.
So on that last slide, it actually showed how the peaks are different for the two species of mosquitoes. And we're going to be focusing on the Aedes aegypti, which carries the dengue virus, as we look at a step-by-step process to implement impact-based forecasting for predicting arboviral disease.
Yeah, in this presentation, we will present step by step, introduce the priority health risk, stakeholder mapping and coordination agreements, sourcing for hazard, exposure, and vulnerability. And then we pass the floor to our colleague Rachel to explain more about the forecasting model, the threshold, triggers, and lead time, and finally, the visualization tools.
So our first step is actually we need to begin by assessing priority health risks before we do anything. Why are we looking at this? Well, we know that climate change is exacerbating and increasing drivers of health risk that are related to disease outbreaks. Dengue is known as the silent killer globally, and it is a growing threat in the wider Caribbean region. So as we go through these steps, we're going to be looking at our rationale, why we do something, what are we going to be doing, and how we're going to be doing it. So this hydrometeorological impact-based forecasting model for anticipating health risks is focused on arboviral disease, and it's going to be based on initial work to predict dengue in Barbados. And this builds on existing dengue research that Rachel will tell us a little bit more about in a moment, and some existing relationships with key health and climate stakeholders. Relationships are a very important part of the architecture of impact-based forecasting, and we're going to apply a risk matrix to support this dengue forecasting. So let's get started. Juan, can you tell us about the first step?
Okay, thank you, Jano. Yes, this is a key step to building an operational partnership among the key stakeholders and end users to ensure the commitment and the implemented this kind of climate service for health, especially. We require a new work in terms to the working very close for hydrometeorological service and public health agency and other actors working together to implement this impact-based forecasting forecast. What we need to develop and share the vision to enable new ways working with interdisciplinary teams. Yeah, many countries they are working, but we need to more and more disseminate this kind of work in terms to implement this new approach to impact-based forecasting. How we can building this? This is a good example in UK. Is a natural hazard partnership This group established in 2011 and provides all information for research and analysis of the natural hazard to develop more effective policies, communication, and service for the civil contingents, governments, and responder community across the UK.
Great. So looking at those relationships, primarily between meteorological services and public health agencies. So the next step has to do with data, information, sourcing hazard, exposure, and vulnerability data. Remember, Juan showed us these are the foundations for impact-based forecasting. To make an impact-based forecast, we need obviously the rain and temperature data. We also need the exposure, the population, and the vulnerability data. So that's going to be this epidemiological surveillance information. We need to look at historic outbreaks or historic impacts so that we can understand if our model works. We need to gather this information. A principal challenge is actually obtaining epidemiological surveillance data, which in many developing countries is generally limited, maybe difficult to access, but we need to start with what we have. Key mosquito-borne disease information, we use this to look at the historical outbreaks and to analyze the influence specifically of climate variables. So case data, outbreak data, may come from national public health offices or health surveillance databases. Population data may come from national census or other reliable databases, maybe in planning ministries. Meteorological data, including minimum and maximum temperatures and daily precipitation, rainfall, as well as some indices like the Standardized Precipitation Index, known as SPI. These are all calculated by meteorological services. Can I have the next slide, please? Thank you. We have encountered some challenges in this applied research that we wanted to share with you. So the absolute number of dengue cases in this study, it is relatively small, even in outbreak years. So this limits the statistical modeling because understanding the dynamics of outbreaks is based on historical behavior. We look at trends in time series. So comparison of meteorological data, according to the WMO, for comparison, we usually need about 30 years of data to have robust climatology. But as I said earlier, we have to start with what we have. So another challenge is also, it's to ensure good spatial distribution of the data. And as outbreaks and climate conditions vary spatially, developing an IBF model for mosquito-borne disease risk on small islands can be spatially challenging if we don't have robust granular information to identify hotspots according to population centers, for example. So a good spatial distribution of surveillance and meteorological data is needed ideally to determine impact at a granular scale. But to begin, we may have to look at a larger, coarser scale. Factors such as human movement, things like insecticide resistance for mosquito-borne disease, community mobilization capacity, these are very important in determining how outbreaks occur. However, they also make the prediction system vastly more complex. So in this initial study, we did not consider these non-climate factors. Let's go to step 3.
Thank you, Janet, to share the sourcing of the data hazard exposure. And now we will present the forecasting model. I am stopped here and pass the floor to our colleague Rachel to show this.
Hi there, can you see my slides? Yeah.
Yes.
Okay. Thanks.
Great.
Thanks a lot. Okay, so the work I'm going to present builds from a body of work that we've conducted in the Caribbean with several partners at the Caribbean Institute for Meteorology and Hydrology, the Ministry of Health and Wellness in Barbados, the Meteorological Services, my colleagues Dr. Anna Stewart-Ibarra and Dr. Sadie Ryan and team. And we started off collaborating in the region in 2017. And through our initial collaborations, we co-designed a modelling framework to help us understand the impact of hydrometeorological streams on dengue risk in Barbados. We also conducted a series of stakeholder questionnaires and assessments to understand really the needs and perceptions around Aedes transmitted diseases. We also published in the Meteorological Organization Bulletin on our work trying to strengthen climate services for the health sector in the Caribbean. And as we know, the Caribbean region has been facing in the last few years a crisis of occurring epidemics of dengue, chikungunya and Zika, which are all transmitted by Aedes mosquitoes. And it was noted by our partners in Barbados, which is one of the most water scarce countries in the world, that during drought events, there seemed to be a change in the dengue epidemiology. So we developed a prediction model using a Bayesian hierarchical modeling framework that we'd previously developed in other places in Brazil and Ecuador to help us understand and predict the probability of outbreaks using climatic information. But because we wanted to try and understand not only the impact of warm and wet conditions, we wanted to see if there was an association with drought. We adopted a distributed lag nonlinear modeling approach. And this allowed us to identify two high-risk situations. So when we have a drought event, around 4 to 5 months later, our model predicted an increased risk of dengue. But there was also an increased risk of dengue immediately following exceptionally wet conditions and 1 to 2 months after warmer than usual conditions. So using this distributed lag nonlinear approach, it relies on a combination of climatic drivers from 0 to 5 months in advance, according to the time window we decided to examine. And so we proposed in this study that you would need a combination of observed and forecast information to be able to iteratively produce probabilistic information in your lead up to your target month. And this kind of finding has been reported in the Caribbean Health Climatic Bulletin. For example, our work was cited when drought conditions followed by a forecast of exceptionally wet conditions was predicted in the Eastern Caribbean, and this included a warning to increase dengue control in these areas. So through this, the study that Juan and Jano were describing, we were working even closer with our colleagues, our meteorological experts and our health experts, and we realized that in an operational situation it's not practical to be having to source both observed and forecast data for 5 months in advance and to be successively repeating that. So we wanted to try and come up with a framework where we could just identify the best lags and interactions between those to really understand if we do have a drought condition followed by exceptionally wet conditions and the temperature conditions are appropriate, then what is the ideal set of lags to help us predict the risk of dengue? And as we didn't have data available to us for the island level for any of the other drivers of disease risk that Jano mentioned, we included both monthly and yearly random effects in our model to help us account for those seasonal factors that are not explained by climate and intraannual variation that may be due to things like serotype switches or changes in vector control. So using this model, this is just giving us a couple of scenarios. So if we have a cool scenario where temperatures are around 21 degrees C, we can see that we see slightly elevated risk when we have exceptionally wet conditions at a short lag and drought conditions at long lag. Whereas if the conditions are very warm, we can see that we will have an increased risk when conditions are particularly dry at long lags, and then in all the situations at the short lag. So this kind of information can be combined and to produce probabilistic information of exceeding predefined thresholds. So here we're using the 75th percentile of the historic distribution as our trigger threshold, which is a threshold typically used in WHO reports. The third quartile is a threshold that tends to be used. And here, this is just showing us using this model, what was the probability of an outbreak according to our model, and then the X indicates if there was an outbreak or not using that threshold. So we can see that this model, according to a ROC analysis, did better than randomly guessing. It's not a perfect model, but using this combination of climate indicators, we could provide some additional skill as to the probability of an outbreak several months in advance. So this is a schematic of our framework. So if we were to observe hot and dry conditions in around February, and this was followed by wet conditions that we would be able to predict using climate forecasts, then this information would predict a high risk of a dengue outbreak. Whereas if we were to see cool and dry conditions and it continued to be dry into the next season, then our model would predict a low risk of a dengue outbreak. So our implementation challenge is trying to translate this information into probabilities that can be converted into action. So we're currently working with the Barbados Meteorological Service, who have been working to produce a mock-up on their platform of how we can present this information. So we're hoping to provide a map with a colour associated to an impact event and the confidence of that event. Because we're dealing with dengue risk, our partners in the meteorological services are really only interested in the probability of exceeding the threshold and then how certain we are. So rather than using this whole matrix, we're likely to be just using a column of probability of an outbreak and then showing our level of confidence. So if the probability of exceeding the outbreak is more than 30%, but less than 70%, and that would probably be considered a medium risk, whereas if it's more than 70%, then it would be considered a high risk. So this is work in progress that we're hoping to be able to complete through a Wellcome Trust funded project. So another implementation challenge is having the technical capacity and the financial resources. So in the project we conducted with the Red Cross, we were able to produce a methodology and a demo, but we really need to move forward to be able to have the resources to actually package up these results, turn it into something that can be reproducible, sustainable, and used locally by the meteorological service and the public health to feed in new data and generate this information on a routine basis. So that's another gap we have. This was a training activity that we provided to partners in the region, where we gave a demonstration of our methodology, and this was a really nice experience to be able to share our results and listen to the questions and take on feedback about the sorts of visualizations that we should consider in this sort of impact-based forecasting framework. So as I mentioned at the beginning, I've recently moved to the Barcelona Supercomputing Center. This is an image of the Mare Nostrum supercomputer, which is one of the most powerful supercomputers in Europe. So this is allowing us to conduct high quality climate forecast and prediction studies. So I have just launched my group within the Earth System Services team alongside the Air Quality Services, Climate Services and Knowledge Integration team. We've just launched a new project funded by the Wellcome Trust on harmonizing multi-scale spatiotemporal data for health and climate change hotspots. And of the toolkits we're going to develop, one of them will be focusing on small islands. So if you'd like to learn more about our new projects, we've launched this harmonized project, and we've also recently launched another Horizon Europe project called ID Alert, where we're looking to build resilience to infectious disease emergence in Europe. We also have some job opportunities available. So thank you very much for your attention. I'd be happy to take any questions.
Thanks a lot, Rachel. Juan, Jano, would you like to complete or to add other information, or shall we open the floor for questions and answers?
I'd like to start off, Rachel, with kind of a broad question for you about the applicability of this IBF methodology that we've developed for broader health risks. I know that across, for example, the Sahara and Sahel region, where meningitis is a recurrent, kind of endemic disease risk, there are climate factors like dust, temperature, and moisture. And I'm wondering, could you just, maybe give us an overview of, some of the broad areas of, other health risks that you see this methodology potentially being applied to in the near future?
Sure. So, I mean, we're using a statistical model framework, so it really just relies on historical empirical data to be able to formulate that model. So, if we have a time series or a spatiotemporal data set of a particular health outcome, and we have those climatic drivers and any other socioeconomic indicators, then we can work to develop a model to try and learn and train and understand any of those associations between the climate indicators and the health outcome. And it really depends what you're modeling. It's been interesting in our recent research that we've identified these long lag and short lag interactions between the hydrometeorological extremes. But if you're working with something like temperature-related mortality, you'll be working with a different kind of epidemiological model, so you can account for those extremes, both in extremely cold and extremely hot temperatures. If you're working with dust, you'll also have a whole new set of hypotheses to work with. So it's really very much a problem and a site-specific issue, very dependent on data and experts from those different health domains.
Oh, thank you very much, Rachel. I mean, indeed, one of the things is that whether we have enough data to generate the model, so that that would be a key questions. Valentina is also interested to ask also questions.
Thank you. Yes, actually, it is related to the number of cases, and so it's been mentioned in by our colleagues that the number of cases, it's actually a challenge to build the statistical model. So what would be a reference of number of cases needed to have a better model or a more solid basis where to start? Thank you.
I mean, in Barbados, I would say it's not an issue. There's enough intraannual variability in that data set to be able to determine a statistical model. There are other Caribbean islands where we've assessed the ability for us to try and develop this kind of framework. And if you're in a situation where you have 0 cases recorded most of the time, or just 1 or 2 cases every month or so, then that would be extremely challenging. But if you have, the kind of data we saw in Barbados was not so problematic, but it's very challenging to try and produce a data-driven statistical model if you're working with virtually no cases or just a sporadic case.
Great, thanks. And what about the duration? So like Jano has been talking about that for climate models, it should be like 30 years to have a robust model. In case of epidemics or dengue, in this case, how many years we should look back at least to have an idea of data? Because sometimes in many countries we have not that long historical data.
I mean, I'd say as a rule of thumb, probably at least 10 years. That's still quite challenging for a time series model. I mean, if you're lucky enough to have some sort of spatial resolution, if you have spatially resolved data across a geographical area, then that would certainly help. But yeah, I mean, if it's less than 10, that would be quite challenging.
Yeah, thanks a lot, Rachel. I think the panelist has been asking a lot of questions. Participants, feel free to raise your questions either in the Q&A or raise your hands and we'll give you the floor. In the meantime, I also would like to I'm so much interested into this. Another question that's already mentioned in Juan by Juan is that for the epidemics prediction, we also need to talk about social economics and human factors such as population behavior that can make it very complex. So the fact that we did not include this information in the models, how it affects the accuracy of the models, would you advise to try to find a way to include such variables or indicators in the models or not, or shall we keep on with what we have for now?
Well, certainly in other studies, other places I've worked where we have spatially resolved data, we do tend to include socioeconomic indicators, usually sourced from census data. But if you're working in a small island setting and you only have one recording for the whole island as your time series, then it's difficult to be able to account for any of those sort of spatial variation. And if the assumption is that it's the climatic anomalies that are driving your dengue outbreaks, then by using the climate information and then including in your model your random effects to be able to account for those unexplained interannual variation factors, which might be the introduction of a new serotype or perhaps a change in vector control measures. So there are ways to sort of mathematically account for that. And often a lot of those other drivers, it's impossible to predict those factors. So that's the advantage of using climate information, that you can, where there are skillful forecasts, you can use forecast information to try and predict the probability of an outbreak given the climate conditions. So it's almost like a bit of a sort of climatic indication, a model that provides a climatic indication of the probability of dengue risk.
Rachel, I'd like to ask you a question following on from that. If the model indicates a trend, would the model be able to give us pointers where we might want to look for specific types of demographic information? For example, I'm wondering about how peaks in outbreak and secondary peaks might point to issues like, people storing water in containers near their homes, which is essentially putting an ideal breeding site for dengue carrying mosquitoes exactly where people are.
So I don't know if I understand the question.
I'm wondering if you can interpolate from the historical data where we might be able to identify with a little bit further sort of social factor research, the underlying, drivers that would inform intervention measures. For example, in Zika campaigns, there was a lot of focus on this issue of water containers around people's houses. Presumably that would show up in the data as
well, that's our hypothesis related to the long lag between severe drought conditions and dengue, because we think that is related to additional water storage due to the drought conditions, which is providing additional mosquito breeding sites. And then we think, because we've also seen this relationship in Brazil and now also in Vietnam, we think that this is there's an interaction between having those drought conditions which force people to store water, and then if that dry period is followed by an exceptionally warm and wet condition, which we know is favourable for dengue outbreaks, then that combination can increase the overall risk of dengue. So that is the water storage issue is sort of the link, we think, between the drought conditions and dengue.
Yeah, thanks. Yeah, I think that's really fascinating. I did not really make link directly on the drought, and already the people have the practice to store water, and that lead to the possibilities that they're having more mosquitoes. So that link is already foreseen, and it was not very visible immediately. It's super interesting. We have questions on the chat. How can the gaps in inadequacies and lengths of data can be mitigated in this model? in a way that does not compromise the reliability and validity considerations?
Well, I don't know if it really can be mitigated. I think it's just a limitation of the model. So, I mean, the only way you can improve the situation is by collecting the right data, providing the local teams with the resources needed to collect the right kind of surveillance data, if possible, being able to detect the type of serotype, because that would help us be able to understand if any dengue outbreak is related to a serotype switch, or if it's related to an El Nino event or some other sort of intraannual signal. So yeah, I mean, we mentioned that we wouldn't build this kind of model with less than 10 years of data. The more years of data, the better, because particularly if you believe that your dengue outbreaks are related to these climatic anomalies, which are usually related to large-scale phenomena like the El Nino, you need to have sort of observed enough of those events in your time series to make those links.
Great, thanks a lot, Rachel. I hope we already answer your questions. Another question that's coming up from Malika: do you foresee a possibility to integrate this model in other types of hazard predictive models, such as drought, to envisage multi-risk anticipatory approach?
Yeah, that would be wonderful. I mean, if we had data on multiple health outcomes, it would be very interesting to explore an approach where, given a particular climate event, you could produce a forecast on a package of different climate sensitive diseases or outcomes. That's certainly something that we're hoping to explore in the Global Health Resilience team at the BSc.
Great. And waiting for other questions to come, coming back to the small island context, because this is actually one of the focus of our studies. I'm also very happy to see that you also have a specific projects on small islands. When we see the visual tools, well, we understand that due to the lack of data, if there is a risk, the entire Barbados could be red. Then that would be tricky to trigger early actions, since of course Barbados is also a small countries, but then to trigger the activation of on the entire countries, it can be costly. So since you're also working toward the small island context, what would you advise that should be taken into consideration in the small islands we're working in the Caribbean? St. Lucia, Dominica, all these are very small, and we have the risk that whenever there is a risk, the entire country it's red. What should we do? We accepted that it would be have to work at the entire country level, or can we find a way to really scaling down or having a smaller scale of our intervention?
Yeah, that's a good question. So I think that you can sort of produce an early warning of a probability of an outbreak given your climatic conditions, be it observed or forecast or a combination. But then you'll probably want to combine that with some sort of local knowledge and GIS information to understand where really are those hotspots of risk, where are those vulnerable populations living, and then to sort of intervene in those areas. In the project, we're going to be working in the Dominican Republic, and we're hoping to use, for example, drone data combined with satellite images to try and understand those areas which are more vulnerable. And also we want to deploy weather stations in alongside health centres and hospitals, because usually weather station data is sourced from airports, which tend to be decoupled from the zones where high disease transmission is actually happening.
Super interesting indeed. Normally the airports that are the one who do on the forecast, and indeed, whereas they are not really the only one that concerned with the weather. There is another question here from Mag. Having cost benefit type of analysis been done between balancing permanent long-term prevention measures, say making sure water containers near home cannot become a breeding site with the short-term antivaccine that can be triggered by the IBF models? It's a little bit a long questions. I
think that might be a question for Jano and Juan, because I'm not sure the answer to that one.
I would say the quick answer is that that's an excellent example of the opportunities for further research to improve the use of this forecast-based anticipatory action approach, the forecast-based financing approach, and also the application of IBF models that, these trade-offs, understanding them enable us to make better use of scarce resources. And that is always going to be, the so-called bottom line.
Yeah, indeed. I think the impact-based forecasting is actually the very first step, as we all know, to develop a full forecast-based actions models. And at this stage, we are trying to identify the potential forecast with different potential lead time. The next steps that you all said is also to identify with on these lead times what we can do, and also identify the probability, the accuracy, depending on. I think it definitely. The next steps to be done, and we are very much looking forward to continue this work, and that's the reason why we have this webinar to have more knowledge, more information, to learn on how to continue this excellent work that had just started.
Well, thank you so much. I have to leave the call, but I'd be delighted to, explore opportunities to be able to further this work more. So please get in touch and look forward to working with you all again.
Thanks a lot, Rachel.
Thank you. Take care. Bye.
Bye.
Thank you, Rachel.
Thanks.
Well, I think if you do not have any other questions, we give the time for Juan and Janu to present the virtual tools, simulate how we can enter data to predict the dengue forecast. Over to you, Juan.
I can maybe help with a little bit of an introduction. Rachel showed you a slide with the map of Barbados, where it was all one color, and she showed the impact-based forecasting risk matrix with the green, yellow, amber, and red risk code. So Juan is showing the visualization tool on his screen that was developed in collaboration with partners in Barbados. So the Barbados Meteorological Service has been one of the pioneers in impact-based forecasting as part of the Weather and Climate Ready Nations program in the Caribbean region, with CIMH and CMO, the Caribbean Meteorological Organization, as technical partners, and supported by NOAA in the United States. And as you can see, Juan is using a slider on this visualization tool to scroll back over time through all of the time series data that Rachel mentioned, which has been loaded into this model with a map that allows us to see the combination of conditions conducive to dengue. Historically, it's a confirmation of the risk conditions which are used to train the model. So Juan, would you like to put the link to this model in the chat? We thought it would be fun to give all of you an opportunity to play with this model hands-on. And if we can put the link in the chat, there we go. Juan, would you like to explain a little bit about the Shiny app, how we developed this visualization tool?
Yes, Janu, thank you. Yeah, this is part of our research to develop, together with the London School of Hygiene and Tropical Medicine, this tool. This is the part of the Rachel team to develop this tool to apply of the data from surveillance and climate drivers into the dashboard. The Shiny is a tool from the R language. This is a computational language.
We
These
use
tools-
R code, just for those of you who don't know computer programming. R code is a type of code that we often use to do analysis of probabilistic, risk.
Yes, thank you,
Thanks,
Jenna.
Juan.
Yeah, this is open source, so this is interested if we can share with the partners in terms to the improve these tools. We are the source is available to include another variable. For instance, if, as Rachel mentioned, to try to put other variables that is socio-economical indicators. The tools have showed all the cases reported, and we have the probability to exceed the outbreak thresholds that Rachel mentioned in the presentation. Also, we can to simulate the forecast with the user-defined values that Rachel mentioned the thresholds. For instance, I will include the minimum temperature, the standard precipitation index is when is the minus is the dry conditions. This is the observer conditions when we receive the information for the Met Survey, for instance. And the other input is the same index, the standard precipitation index for forecasting. In this way, we can condition to try to exceed the thresholds, try to define the potential outbreaks in the next months, maybe 3 months. And the thresholds we use two different thresholds, 0.75 and 0.95, and they run the simulations. And if you observe, this is the cases, the model running very quickly and show the probability, what is the alert of the level. In this case, we put the conditions to the alert level is the high risk, and show in the map all the risk map for whole the island in this case.
Yeah. So if you want to click on the link, thank you, Toy Bing, for putting it into the chat. It's going to open the first screen on the visualization tool. You'll see the map of Barbados, and over on the left, you can play with that slider that Juan showed you. You can scroll back in time and see how the risk level is indicated. Red is going to be the highest risk. Pink would be a slightly lower risk. Green would be a low risk scenario. So yeah, there we are. So try just moving that slider, and you can go back in time and identify where there were high risk and outbreaks in Barbados. So this is all the historical information, which is loaded into this simulation tool. So where are we? What is the date on that? I can't read it.
This is July 7.
2017, was it?
July 27.
Yeah. Now, what we were talking about earlier, as we go forward, as the collection of the surveillance data in time becomes, Rachel was talking about how, there's a need to begin to collect more granular data. As we collect that more granular data, this model can become more spatially differentiated, so that the future that we envision is that we would actually be able to see gradations in the level of risk within the country of Barbados, with the amount of data that we have and the granularity of this data, we can only show one level of risk for the whole country, which is still a step forward, because we can use these simulations when we understand what the conditions are that are conducive to an outbreak. Then we can program activities to lower that risk, to mitigate that risk. For example, emptying water containers or covering them to prevent breeding. These kinds of measures can now be initiated before an outbreak, whereas the standard operating procedure for mosquito-borne disease outbreaks is generally we wait until we hit a significant caseload documented by the Public Health Service, and it is at that point that the public health interventions are programmed and the financing is teed up depending on the severity of the outbreak. So already, even though it's very rudimentary and it's using the available data that we have, in Barbados, we have a tool that allows the Public Health Agency to anticipate those precursor conditions. And that allows all the disaster management agencies, as well as the public health agencies, to launch the awareness campaigns before an outbreak. And launching a national awareness campaign is kind of a low regrets approach. But over time, as we are able to identify which population centers may have higher risk than others, then those public health measures, the preventive measures, can be progressively tailored according to the granularity of the forecast. So on this visualization tool, up on the upper right, Juan showed you, you can click to open the tool where you can change the variables in the simulation, and it will show you the outputs of the model using the variables that you put in. Would you like to walk us through this, Juan? Maybe you could suggest some variables that people could enter on the left, in the fields on the left, and then we can see how the simulation produces a risk forecast for us.
Okay, yes. Yeah, in the example, I put in the minimum temperature 26 degrees. Remember when the Rachel mentioned about the thresholds, the minimum temperature, if we have an outbreak, is more than 25.3 degrees. The standard precipitation index is dry or wet. It depends of the lead time. In this case, I include that standard precipitation index in the minus value for -2 and -1.5. The lead time or the month is depends when the initial condition starts. If we increase, for instance, the temperature, maybe 27 degrees, and run the simulation, maybe the cases are more, the predicted cases are more in the high risk level. The median of the cases increasing. If we put more, and yeah, the cases increasing, more temperature, and the cases increasing here, and the high risk, of course, is the same high risk. This is depends what is the initial condition and the forecasting condition we will to simulate the potential outbreaks in the next months.
Well, thanks a lot, Juan. I think I hope that you enjoy playing a little bit with this tool, and this is also tools that basically enable us to hand over the models to the local stakeholders. So it would be them to monitor the situation, to enter the data, and on that basis, it would show the potential outbreaks that coming in specifically times. So it will not be controlled by any kinds of actors out of the country. So in terms of local ownership, local of the initiative of the models, it is very, very important. I see that there's just a lot of people who's already leaving. I guess that you're also running to other meetings. So I would give the last chance for any last questions. Otherwise, we're going to close the webinar now, as we already having quite a lot of time for the discussion and questions. So I count to 10 for the last questions. Anyone raise your hand?
So I see there's one question about ideas to further develop this. So just wanted to share with you that Barbados Meteorological Service leaders in impact-based forecasting, if you go onto the Barbados Met Service website, you'll see across the top a lot of buttons for different hazards that impact-based forecasts are being developed and disseminated for. So Barbados Met Service has actually developed a beta dengue button. It's not visible yet because it's not ready. It's not ready to be utilized, but they have built it, and it will become part of the impact-based forecasting tools, services for public information and awareness that are going to be on the Barbados website as this work proceeds. And we're enormously grateful to our technical partner, Rachel, and her team with London School of Hygiene and Tropical Medicine. And we're also very, very excited that this work has already attracted additional financing that enables her to continue to work on those really crucial stages with the partners in Barbados, with the Health and Wellness Ministry and with the Met Service. It has to be reproducible and robust and sustainable before a new tool can actually be operationalized.
Thanks a lot, Jano. I think you're stealing my conclusion remarks. Well, since I count until 10 and there was no other questions, so thanks a lot, everyone, for your patience and your participation. I hope that the presentation was interesting and helpful for you. Well, just for your information, that this webinar is recorded, and so the recordings and on the presentation will be sent to all participants. From the Friend Red Cross side, thank you very much, Jano, Juan, Rachel, and on the teams for great work done. We continue to explore this possibility. Of course, this is very innovative. It started. There is things to improve. There is areas to look for further information, but we're happy that to say that it's possible, and it is important to continue working on that. So we keep you informed of the upcoming activities of the Friend Red Cross. We are exploring the possibility to do impact-based forecasting, forecast-based financing for epidemics like cholera in other countries. So hope to catch up soon with more information, more discussions. Thank you again for everything, and hope you have an excellent day, an excellent afternoon.
Yeah. And just in conclusion, I also wanted to just extend enormous thanks to our colleagues at CARFA and also to CIMH, Caribbean Institute for Meteorology and Hydrology, who have enormously assisted in this research, this preliminary research, and who really have the interests of the region for the long term very much in mind, for how other countries that may have the requisite data could get involved in developing dengue prediction and bigger picture health risk forecasting tools for the region. So thank you.
Thank you. And if I may add, also the French Development Agency, which supports a lot of studies that we're running at this moment on anticipating epidemics that allows us to progress on this topic. Thank you very much. Thanks, everyone. And I guess we'll keep in touch on the next steps of this work.